Well, it's 3 o'clock and I can't actually tell because I'm new to this whether people are joining. So we're going to just give people a few minutes, but and by the next time we do this, we'll be old hats at doing Zoom virtual town halls. But we'll just give people a few minutes to join and start with a big thank you for taking time to join us today. I'll introduce myself again in a second, but I'm Margaret Crotty, and I have the honor of being the Executive Director of Partnership with Children. I realized that my 8th year anniversary was last week. So we've been through crises before. Partnership with Children was started in 1908 and has been serving children since then. And we have every intention of seeing the families and students that we serve through this crisis as well. So it's just about 3:02, so I think we'll get started. Again, welcome to everybody who has joined us today. I am touched and overwhelmed. I mean, I think our panelists, we're all a little bit overwhelmed by how many people are joining us today. And I think it just shows that we're all trying to do something to contribute and to just figure out what is going on in these very unprecedented times. So I'm Margaret Crotty. I am the Executive Director of Partnership with Children, and I have the great honor of working with my colleagues who are on the panel today, and I will introduce them quickly and then allow them to say a little bit more when they speak. But I'm going to go around in the way that I see everybody. Yvonne Mbewe is to my left on my screen, and she is a social work director at one of our schools on the Lower East Side, and has been with us for several years, actually, even though she took a break to do the Peace Corps and came back. And then I see Derek Anello, our Vice President of Programs. He oversees all of our community schools, which is an incredible initiative by the Department of Education. And we are one of the lead providers of community school service and mental health services for community schools in the city. And Lola Martin, who's our clinical director and also co-chair of our Diversity, Equity, and Inclusion Council. And thank you all so much for being here. As I look, and I think we're on week 7 now, I know you are all working as hard or harder than ever. The stakes are as high or higher than ever. And so I really thank you for taking the time today. Partnership with Children, as I said, is we were founded in 1908, and we have been serving children in New York City ever since. We put full-time staff into New York City public schools. We're in all 5 boroughs. And we have an affiliate called the Center for Arts Education, which uses arts to reach children who might otherwise not be reached. And together we are in 100 schools and serve over 30,000 students around New York. I wanted to start with a question just about our program is rooted both in social work and neuroscience, and it's really about the importance of relationships. And I think this is something that all of us can relate to right now, the importance of relationships. But I often talk about how a safe relationship is really the mitigating factor for the stress that many of our families and children experience. And how do we move that online, and how are you doing that? And I thought, Derek, I'd start with you. If you could also just talk a little bit about what a community school is in normal times, and how does it become virtual?
So just briefly, our community school model, which is a model of integrated student supports that ultimately is, I often say that we're in the solution business. And what that looks like on the ground is that we provide wraparound services for students, for DOE staff in our partner schools, and for parents. We do a lot of work in bringing community resources into the school building to create a community center within a school. A big part of our work and what our core program is our mental health work. And I think that Lola will likely talk a little more about that.
Yeah. So once again, I'm Lola Martin. I'm a clinical director at Partnership with Children. So a lot of the things that we do are around supporting our staff within the schools, within the various programs that they're in. So that includes becoming thought partners with principals around how to best infuse social emotional learning in the schools how to shape the program so that it meets the need that we're setting out for it to meet. And then, of course, part of the core of what we do is provide clinical supervision and support to our staff there at the school, helping them to think through their cases, think through the practice, the daily practice of serving our families, and providing any additional support, sometimes professional development at the school, and then, of course, meeting the needs of our staff to make sure they're best suited for what they're doing.
Yeah, and I'll just add, our staff in schools are full-time clinicians, full-time social workers with master's degrees, LCMSWs, and we pride ourselves on that clinical supervision. We don't just put social workers in schools and have them go every day. We have clinical directors like Lola, who have years and years of experience providing clinical supervision, and also providing ways that our staff can provide peer support and peer consultation so that nobody is alone in a school. And I thought that was just really important to think through too now as we've all moved offline. We do have virtual relationships among our team members already. So I'm further away from the work, but you know, for the last several weeks, I feel like the thing that wakes me up at 3 o'clock in the morning is how are we going to know what our families need when school's closed, and how do we know if they're doing okay? How did we prepare for it? And Yvonne, talk just a little bit about how you're keeping in touch with the families and with
Sure. I think one of the great things that Partnership actually did was pre-school closure, we were already having conversations with parents about safety planning and putting together like what are some of the resources that are needed. So before the announcement even came out, we were already kind of one step ahead because we were already kind of anticipating this was going to happen. So we were asking families like, what sort of food items do you have? Or do you have all your cleaning supplies? Do you have access to an internet system? Do you have a laptop? So we already had kind of checked off those boxes and also like made sure we ensured for emergency contacts and things of that nature. So once school closure actually happened, we were in a different position, and specifically for my school, we were able to kind of begin right away setting up our counseling schedules with our students. And what we realized right away was that this was going to be quite a challenge because we were doing therapy in a completely new, unexpected, unpredictable manner, right? So some of the challenges we automatically faced were around privacy. We live in New York City, so we already know spaces are tight. So now factor in families and factor in the fact that parents have lost their jobs, and factor in some people are ill and aren't necessarily able to even be communicative with their families in the way that they should. So we dealt with a lot of those like kind of basic concrete needs right away and assessing how do we even begin to have therapy sessions. And so initially it was a lot of like, well, where can you take your laptop and go find a spot that's private for you? Do you have headphones that you could put in your ear just to like hear me so nobody else hears me? And despite those things, despite the things around like privacy and loss of job or ill family members, I would say some of the positive things that came out of this is that we were able to see families in a new light. We were able to see family dynamics. I was able to see how do you engage with your sibling that is like trying to get your attention as you're talking to me? How does your mom or dad talk to you as they're asking you a question as you're talking to me? So I was also, I think all social workers in this moment were able to get insight into the family dynamics in ways that we ordinarily wouldn't have. And furthermore, I think even the parents that we rarely get to have contact with because during the school year, everybody's busy, everybody's working. Now parents are actually popping in sessions to say hi to me. I'm actually having conversations with parents I never really got to speak to. So I also just want to highlight, like, although this is very uncomfortable, this has really, I think, fortified our relationships with families. It's created a more trusting dynamic where we get to see them in new ways and they get to see us in new ways.
And Derek, if you could just talk, I just remember those last few days before school closed, and you know, we didn't know any more than anybody else, nor did the principals know. Nobody knew when school was going to close. But I always felt very confident that you and your teams had really prepared. And just talk a little about those last few days and what we were doing and how we were thinking.
Sure. So probably the Wednesday prior to school closing, we saw the potential for this to happen. And we really just came together as a leadership team and triage what are the things we're going to need to be ready to hit the ground running on the other side of this. And Yvonne referenced doing safety planning with all of our kids, particularly our high-risk kids, and helping them identify who is a safe person that you can access in your day-to-day life if you're not seeing us every day at school. Working with the student and their parents to get updated phone numbers. Communication via phone is often very difficult with our families. And so it was critical in those last couple of days to get working updated phone numbers. So we had a way of getting to our caseload kids, but also in our community schools, all of our students. So we really led that work, and that prepared us for the thing that you couldn't really be prepared for, the Sunday night decision the schools weren't going to open on Monday morning. So we were ready with a plan. We had our students ready for that to happen. And our principals really took our lead and relied on us to set the expectations for this transition. I had a principal call me at 10 p.m. after the announcement at 5:30 p.m. of schools closing on Sunday, and basically like, I need you as my partner in figuring out, how do I do this? What do I need to execute for tomorrow morning? And what is our communication strategy, and how do we deploy all of our resources to make sure that we're getting in touch with every community member so nobody falls through the cracks? And the ability to do that really gave us the opportunity to assess family needs and staff needs to make this insane transition, ultimately overnight, from being live in a school building 8 hours a day to living a virtual life and doing all the things we do in a virtual way.
I want to talk a little bit about the bigger picture of what we're seeing, but first, just one quick housekeeping thing. We will have time for questions at the end, and if you could use the Q&A icon at the bottom of your screen, we have our colleague Marielle who will be reading us the questions at the end. So Lola, help me sort of explain. We're hearing a lot in the news about how communities which are really similar, and the same communities where we're working, people of color especially, are being the hardest hit by COVID-19. And I think for many of us who think about this all the time, and we talk a lot about how there was already a public health crisis in the neighborhoods where we work, of chronic stress and trauma for kids. Tell us what we're seeing on the ground, that sort of on that bigger topic of our communities are really going to be the hardest hit, already are, and I think the tail of this crisis will be the longest for them.
Sure. So we're looking at a couple of different things. We're looking at how this pandemic is impacting the pretty much largely, almost completely, communities of color that we've been working with on a daily basis. How, as you said, how they've already been dealing with chronic illnesses, a lot of times unsafe work conditions, and various things that have led to greater rates of illness. I mean, if you've been watching the news at all, you've been hearing the statistics. So we're looking at that, how our families who are already vulnerable to unemployment, to maybe not getting adequate health care and food insecurity, how we were working with them with those needs already have been further exacerbated by this pandemic. We've been working with that, and looking at how our staff, who is largely in communities of color themselves, have been impacted as well. We have to keep both of those things and hold both of those things in mind, because how can you care for others if you're not caring for yourself? So some of the things that we've been doing, and I can talk more about, or even Yvonne can talk more about how we've been directly assisting our families, but I'll talk a little bit more on the staff support side, as that is largely what I do. We are in experiencing this pandemic along with everyone else concurrently. So we have had staff members who have been ill. We've had staff members who have family members who are ill, who are also home with young children or caring for family members. And so we always have to think about how are we upholding them? How are we caring for them as they are caring for others, as they have to care for themselves? And so making space for them to discuss the frustrations that they're having because of the greater society and systemic issues that are in place, how they are frustrated at how, you know, them and their communities are portrayed in the media, and how, or even the reality of what they may have not have access to, or what they have access to is not adequate. And so we've been an ear for that, providing spaces for them to express those thoughts and feelings and frustrations, as well as encouraging them when they need to take time away. They need to go take care of themselves, whether it's their health or their mental health or their families. And so really encouraging them to do that, and to, so that they can still be present, because as social workers, we are always present. We are always putting the needs of our clients at the forefront, and we need to care for ourselves as people of color, largely also dealing with these same issues.
Yeah, I know there have been lots of gatherings, and I've been privileged to come to some of them, of our own staff really taking the safe places to talk about how they're being affected. And I think, you know, I thank you specifically, Lola, for your leadership on that, because I think it's something that not only makes our organization better, but makes our work better. Yvonne, do you want to add anything about some of the things you're seeing? You got the prompt.
Yes. No, Lola actually said it so eloquently already. I think I just would echo her sentiments as well. We are dealing with communities that have been ravaged by this in ways that others have not, especially if you are undocumented and maybe can't have access to certain resources that you might need, or you don't know necessarily if you will have a job on the other side of this, whereas other people might, they can be optimistic, or they can apply for unemployment. So we are witnessing unique stressors for certain demographics. And like Lola pointed out already, we are just essentially an ear for families. A lot of parents have been calling social work more and more lately. And so that also has shifted how we as social workers engage with them as well. Because typically, you know, we work with the family as a whole, but our focus is the student. But now we're definitely also engaging parents on new levels, because they need that support as well.
Are you, Derek? I was actually going to move to you for a second, and just, I know I've heard from you lots of examples of, you know, really the same issue of the social determinants of health, really, you know, and the systemic racism behind them. You know, this has really shown a light on how our families and communities are experiencing this.
No, absolutely, and I think in our day-to-day work, we know that life expectancy can be predicted by someone's zip code, and code we are most connected to have the lowest life expectancies because of the lack of access to quality healthcare, or healthcare at all, lack of access to healthy foods, and overall resources. So those are things that we were hyper aware of in kind of launching this remote work, and how do we address those things without being in person with families. So you know, a lot of our work really focused initially on our students in temporary housing, which make up about 1 out of every 4 of the students we work with are in temporary housing. So so how do we help? Not only, you know, we had to become tech support in helping families get devices that first week that schools were closed, and that meant that some of our staff were out there delivering those devices, and then working and advocating for those families to get Wi-Fi connections. And I have to say that there has been an incredible partnership with our contract organization, specifically the Office of Community Schools, the Department of Education. They have been incredible. When, you know, when we escalate what we're seeing on the ground as a need, they're like, okay, so how do we support that? How do we create more leverage and more flexibility in how you're using your budgets, and everything from, you know, us identifying. So we get families food, but then there's no way to cook the food in some of the shelters. So so how do we then get cooked meals delivered to families that can't get out to get to DOE sites to pick up meals? And these things are evolving, you know, in real time. We have seen a number of cases where we have single parent households where the parents got sick, and we're on the phone doing check-ins with a 12-year-old who's telling us that mom was taken away in an ambulance last night and they're home by themselves. So how do we solve for that? Those are things that we didn't experience when we were with a student in real life and had the ability to physically keep them safe. So these are just some of the things that are new versions of the work we're doing, but simultaneously, we were literally creating mechanisms to provide everything we provide remotely, and that including enrichment services. And how do we work with the schools? How do we connect with the teachers' Google Classrooms to do SEL work in the classroom with the teachers side by side? How do we do check-ins with teachers at the beginning and the end of the day? Because teachers are carrying these unbelievable burdens where they're being teachers to their own students and teaching a class of 25 students. So how do we build in mechanisms to support them while supporting our staff, while supporting all of our kids and families? And we have effectively, and it blows my mind when I think about it, like it literally makes me emotional that there is nothing that we were doing on the ground that we are not doing remotely now. We have, our team has been so creative and so on their game, working 12 hours a day to make sure that every one of our kids are safe. And it's really an unbelievable thing to witness.
Yeah, I know. I am moved all the time hearing what you all are doing. Yvonne, so you have some fun examples of things all of us who have kids at home can learn from you. But how are kids experiencing this? They're at home in cramped quarters for many of them. Are they getting fresh air? Are they able to go outside? But also, what kinds of things? I mean, I know I see a lot more video games than I would like, but how are kids really experiencing it? And also just clarify, Derek mentioned a couple things, but what media are you using? Is it phone? Is it Google Hangouts? Is it the Google Classrooms?
Mm-hmm. Right. So at Great Oaks, we're predominantly doing Google Hangouts. There are some students who prefer phone. They for whatever reason, they're just not as interested in doing virtual learning in this capacity. And so I will do phone sessions with them after assessing, like, well, can I just see you a few times? Because I didn't understand what that was about initially. But after kind of checking out the scene and safety of a situation, I'll switch to phone if that's what they prefer. And to your question around how are they handling it, I will say that the initial 6 weeks or so or 7 weeks or so that we've been having this school closure was definitely, I think people were in survival mode. Everyone, including teachers, parents, students, myself, I think we all just were like, what do we need to get in place to kind of have stability and kind of have uniformity of like what needs to happen on a given day? And now we're kind of shifting into a different, I guess I would say like phase 2 of it. It's where the dust has settled a little bit and people are kind of now aware of, oh wow, we're really not returning back to school. Because before there was a little bit of optimism around maybe we'll actually get back to school at some point. The reality is now I think people are aware we're not returning back to school. And what does that mean for me? What does that look like for me? And so we're honestly getting an influx of social work referrals. A lot of students are expressing so many different emotions that look like depression, anxiety, sadness. Students are not doing their work. Maybe they're missing sessions. And so some of the families that were maybe stable before are now becoming a little bit unhinged. And the ones that were maybe in crisis before are now becoming a little bit more stable. And we're just seeing an ebb and flow of different emotions as people try to kind of calibrate and understand what exactly did this loss of school, like the loss of the school building and school community, what did that actually mean for me and my child and the community that we serve? And I think what we have been doing as a social work department has been to normalize kind of what the stages of grief are, like really allowing students and families and educators to understand, like, we have a lot, we are grieving something that was very significant to us. And akin to when we lose a loved one, we can similarly apply some of those like stages of grief. What will happen? Some of the denial, frustration, confusion around all of that, and many, many more feelings that will come up because the school building and all of the fixtures inside, the authority figures, the loving relationship with teachers, the camaraderie with peers, whether that's good or bad, but you're getting your social identity and your connection from your peers, right? So all of that was taken away within a blink of an eye, and people hadn't had time to really process. So I think right now, students are really coming to terms of what did that mean, this loss of space for me, this loss of identity for me. And so to that end, we're we're beginning to kind of address that and normalize it for a lot of people. So they're having a lot of typical reactions, but to a very atypical loss. And so we don't know how to process that, right, as a community. And so we're working with families around what does that look like, working with educators around what does that look like. So to that end, we also will start like a grief and bereavement group for students. And I know a lot of schools around the city are doing that already. And we also will start a parent support group because we realize like they also just need a space where they can come and have community with other parents, right? So that they can vent to each other and make community connections with each other. So I do think right now we're in a very interesting phase of this pandemic where finally people are giving themselves time to process the feelings, because in the beginning, I think everybody was just like, whoa, what's going on here? And now that we're in a space where we can stop and breathe, people are giving themselves the opportunity to process it. And so it's really good for us as mental health clinicians, because I think we're able to normalize what they're feeling and allow them to give space for what that is, and know that eventually people will calibrate to like a space that's comfortable for them, but it will take time.
And what kinds of things, you mentioned having more grief and bereavement groups, and I know at one point we put in more professional development over the past few weeks. Lola, tell us a little bit about kind of the need for professional development now, what things you've been doing already, and just as Yvonne said, like dealing with things none of us have dealt with before.
Yeah. So just as Yvonne was highlighting, making big shifts in almost every way, in how we practice and how we provide services and how we're connecting. We have to continue to bolster the skills of our staff in this new environment, in this new remote environment, and in this new environment where grief and loss is coming to the forefront. Grief and loss of all the things she mentioned, from actual family members passing and friends passing away, to the loss of all the things you were used to, all the places you were used to going, all the personal space you may have had that you don't have now, loss of those connections that you made that were maybe as a child in a very difficult home was looking forward to when they got to school, or just looking for that reprieve and change of environment. So in that, we are constantly looking for new ways to support our staff, and those could be paying for trainings, resources towards additional professional development in those areas of grief and bereavement, and just how to best utilize these kind of remote and online platforms that we're now spending all of our time on and wanting to make the best of, so that we can meet the need in the best way. And then also being a thought partner with schools on how to address some of those same needs, and how to best utilize their own technology so that it is engaging. So we're always looking into more resources for professional development, and just being at the forefront of what we need to be and what we need to know so that we can best serve our families and our communities.
Yeah. Derek, did you want to add anything?
None of us signed up or joined this organization to do grief and bereavement work. It just wasn't our wheelhouse, so to speak. So how do we build capacity to do that literally on a dime? And again, our teams, we have provided support. We've done program-wide trainings around this work specifically, but we're learning from our teams on the ground, literally. We have had an incredible number of losses of community members in our schools, school staff. We lost a student in one of our schools a couple of weeks ago, last week actually, and to hold the community up through this forum is not something we'd ever imagined we would need to do, and we've had to figure out how to do it. And whether it's creating memorial walls to share memories of the community members that have been lost within the Google Classroom platform, or creating our own platforms to do it, bringing together restorative circles of students that are specifically affected by an educational assistant in their classroom who isn't in their classroom today. How do we do self-care, daily self-care tasks that are fun for students and for staff, and create a challenge out of it, and then report back at the end of the day by doing a debrief with our students, or having staff go into classrooms and doing that work. None of these things had we anticipated were happening, and I think we have a new set of skills that enhance what we were doing previously, and I am incredibly grateful for our staff for holding that while managing their own grief over things that are happening and these same losses they're experiencing.
Yeah. So I, as you know, and I know you all are, was just a firm believer that the kind of work that we do, you know, is necessary and critical all the time, but will be especially critical during this time, and also as we look toward the recovery when it comes. Can you talk a little bit about sort of that effect of making children feel safe on mental health and social emotional learning, and what kinds of skills you know, we should be engendering in our students and school communities over this time? Why are we going to be relevant over the next several weeks and months and probably years? And I'll let Yvonne start, and but I think you all could really comment on why our work feels so vital right now.
Mm-hmm. I definitely think for everything that we've already mentioned around the loss and grief of not only the school community, but actual the tangible loss of family members or neighborhood community members, well, that in and of itself will be critical for students to be able to process as we move forward. But also there's so much influx around academics and academic standing, and how will students, do they know if they're being passed on to the next grade? So many of the social norms that typically students have, whether that's graduation, prom, all those things that are just no longer going to be a part of this class moving forward, are things that we don't know what that effect will be moving forward, right? Like, we don't know how this will impact them. And it will call for more awareness of social workers and community members and adults in general, educators, to be more sensitive to that fact and the trauma that has been unearthed by this whole process, because I think some things that are traumatizing we can't put a name to yet, but they will come up down the line, and we need to just be sensitive to the fact that there will be more manifestations of this loss in some capacity that we can't even anticipate yet. So just being aware of that, and that's definitely why we need to be part of this healing process, right? And I also just think we'll need to, the beautiful thing about it is, because now social workers are having these virtual sessions in the home and families can see us and we can see them, I do also hope that it lends to the fact that maybe parents will be more open to getting their own therapy. Maybe parents will be more open to the idea of recognizing, because maybe we've normalized the process for the whole family as well, hopefully. And so maybe that lends to the possibility for family therapy. Maybe that lends to the possibility for the adults in the home possibly like being open to therapy, because especially in communities of color, therapy is still something that is very taboo and stigmatized. And so maybe just even having this kind of face to name who my therapist is, and oh, come see Miss Yvonne. Okay, that's Miss Yvonne. You know, those little things, maybe that like shifts the dynamic and the narrative that we have around mental health. And so I do think that we will, as providers, be more relevant than ever, because not only for the things that we know will hurt students, but the many things that we don't know will hurt students as well.
Yeah, and Lola, I saw you nodding. And you might also, if you would, bring in just again a little bit more about the priorities at Partnership with Children to make sure that we take care of our staff in the same way.
Yeah, I mean, I think coming down the line, and this was already in the works, because, you know, social emotional learning was becoming this buzzword in general for schools, and a lot of schools were trying to figure out how to tackle that. And a big part of what we were doing, in addition to providing those direct counseling and therapeutic services, was providing that social emotional learning and figuring out what's the best way to do it. So now that we are going through this time, it's even more apparent that we need to do things that will serve the whole school community. Providing direct services is necessary, and you can't reach the whole entire school in that way. You can't provide therapy to everybody. You just don't have the capacity for that. However, we do have some capacity to reach the whole school in wider social emotional learning instances, whether that be in classrooms or in other ways of reaching directly to the parents. So, for example, and I know that Yvonne mentioned this early on, providing parent support groups, providing sessions where parents can come in and discuss, okay, this is happening.
Yeah.
Listen to their peers about what they're also experiencing, and us finding a way to meet that need and or direct them in the right direction. So providing support to our staff so that they know how to do that. They know how to facilitate those groups. They know how to do the outreach. I mean, I think everyone's getting a real hard lesson in outreach right now, but further supporting them in those endeavors, further enhancing their skill set to, okay, now we have to have support group sessions with adults, and expanding what we've done in some of our schools, which are teacher and support groups. They're going to need support too. And in some of our schools, we already have a strong hold on doing that, and have been able to continue that online now that we've shifted to virtual services. So we do have active support groups going for the adults that are in our schools, because we all know if they can't feel good, then that transfers to the students, and how they can then teach. And in that way, also helping our staff and helping the principals directly to envision, what does it look like as we are providing this these educational and support services? What does it look like to the child? Like, how are they experiencing it? And are we really connecting the fact that, you know, yes, these children are not doing their work. They are refusing to log on. Why is that? Once again, we are in a pandemic, and we have to always think about how that is affecting our kids. And I was actually in conversations with some principals previously around that, because we were troubleshooting around a few students who were just not logging on and weren't doing any work, and you know, really coaching them to understand and see, you know, this is a new thing for them. They may be concerned about their own families who are, whether they're frontline workers, essential workers, or they were sick and are sick, or people who may have passed away and now they're grieving. And a child can't always put words to that. And that's how it can start to look. They are refusing to engage. And so becoming thought partners around, okay, how do we do this? How do we engage them so that they can still learn something? You know, we talked about an educational game, utilizing that for a while, just to warm up the student to being online and engaging in a way where they can still have some connection, and you can see that they're connected, and working with them where they are, so that we are being very mindful of what's happening in their life, and not being punitive because they haven't turned in an online assignment. So we're doing all those things. We're supporting in so many different ways, whether it's directly through the social work staff that are at the schools, or, you know, I myself as clinical director in constant contact with the various leaders in the school to make sure that they are resourced, that they know that we are here continuously to support, being very responsive and consistent, so that they continue to see that we are in this with them, and we're here to really provide that necessary support. And I don't see that ending anytime soon, because we have really been seen as the people who have been very stable in the school community, even as we've made this big shift.
I know, I've heard that. Yeah, go ahead.
So Lola, you just jogged my memory of something as well. In terms of our work, we have to now be so creative, right? Because we recognize that students, one, may not be able to talk about some of the things we talked about in the safety and privacy of our private office. So now we're in these spaces where we maybe can't talk about some of the other things we normally would. So we do have to get very creative about ensuring students are still getting those developmental life skills that are necessary. So whether it's through educational games or other resources. And Margaret, when you said, I'm seeing a lot of video games being played, it reminded me that I actually had a session with a student where it was a dry session. I'm not gonna lie, I was struggling there with what we were gonna talk about and where to take this session. And I just said to him, describe to me why you like this video game. And I think it was Fortnite. I don't know anything about video games, but I think he said Fortnite, if I'm not mistaken. And as he's describing it, I'm still kind of like, still not sure where I can take this session. But then I said to him, why don't we create our own video game? So I see why you like Fortnite, but what if you created your own video game? What would that look like? Who would the characters be? What would the theme be? If you had 1 million of subscribers who wanted to play your video game, what would the message be that you wanted to get to them? And that, oh my goodness, when I tell you he ate that up and he ran with it, he was so excited. Not only did he get excited about the possibility of creating and using his own imagination, but he then recruited other friends. And now we literally have a video game creation club where we're going to begin thinking about ideas for video games. And so it's literally what Lola was describing, meeting them where they are. So right now we can't talk about some things that maybe I think we should be talking about, but I can still help him get to like skills around collaboration, active listening. How do you compromise? If somebody says something you don't like, how do you handle that? So we're still growing and developing and learning the things we need to learn, right? And so we have to, as social workers at this point now, become very resourceful. And so when we talk about moving forward and next steps, one of the things we'll need are incentives to get these things going. And we'll need resources to get new ideas flowing, because we're not going to be able to do social work in the same way that we used to do it before.
Yeah, and I think that really, Yvonne, that really speaks to what being trauma-informed in a remote capacity is and has become. It's meeting the kid where they are, meeting the adults where they are, meeting families where they are, meeting our staff where they are, and being sensitive to the experiences that they're having and coming up with solutions that will address those things. Or maybe that means postponing certain things so that we can be with them where they are and hold that space and hold that clinical space. That means assisting the schools in understanding, what does this mean, being trauma informed? Well, part of it is what I mentioned already, is understanding that academics are not always going to be right then and there and at the forefront for every child at every moment, you know, as they are experiencing this trauma, this very traumatic time for a lot of people. It's holding space for our staff who are experiencing their own trauma at times and have to take time for themselves to deal with it. It's helping the school's culture and climate as it has shifted to online learning, informing that as well in how academics are being facilitated, the expectations, as well as providing allowances where needed.
Yeah. So I have one more question, and then I think we'll go to Q&A. And I just want to remind everybody to please put the questions in the Q&A with the little bubble icons at the bottom of the screen. But I just want, I'll just ask my last question and then we can move on. Both Yvonne and Lola, you mentioned being resourceful and being nimble. And so I think, Derek, you know, I've been worried, and I know you share this, like, how are we going to innovate? What are we going to do over the summer? You know, what's going to be different? What are you worried about? And what do you think we can do? What are we well positioned to do?
I think so. Yeah, this is kind of the next layer of the evolution of this work, and when the traditional school year ends in June, which it will, and there's no summer programming planned this summer for our kids, which creates all kinds of safety issues, all kinds of mental health issues, all kinds of educational gaps. We're looking at, like, what do we typically do in the summer? How do we translate that into, or escalate it even, and amplify it to bridge some of these gaps? And you know, we have the last couple of summers and a bunch of our schools used a very an amazing, culturally accessible and relevant curriculum to do some literacy work with kids, to also do lots of enrichment. And we have already started doing some of the enrichment work remotely now, infused into the school day, where we're doing mindfulness activities, not only with kids, but with kids and families, and with teachers. And, you know, principals are often saying that we are the thread that keeps the entire community get together, because we're the only ones doing work with parents and teachers and students and staff. So how do we bring that into the summer? How do we continue or build some capacity for as an organization to do work over the summer that we haven't typically done or aren't funded to do? For example, it is going to be critical for us to continue our mental health work with kids and even just from a safety perspective over the summer. And we're seeing lots of evidence of post-traumatic stress disorder already. This hypervigilance. I feel it as an old school clinician. I feel this. That I'm waiting for the next thing to drop. So our kids and families really are. Our parent work specifically. Our parents are reaching out to us saying, I don't know what to do anymore. There are 8 of us in a 2-room apartment, and I don't know how to manage my kids anymore. So how do we build capacity in parents remotely? How do we continue doing that through the summer? How do we prepare kids to come back to school or come to new schools for kids that are graduating 5th and 8th grade? There is no bridge. There's no real closure from their current school. So we were speaking to Chris Caruso from the Office of Community Schools yesterday, and so how do we build a bridge program over the summer where we can support our kids who are transitioning into another school and build some skills for them to be able to do that. So those are some of the things that we're looking at. And
you've really spoken to, ways that we're thinking about using the summer to come back as strong as we can in September. And I think, for me, from my point of view, that means keeping you all engaged and keeping our staff totally intact and working all summer. So I have, I think we'll move to questions. I can see that they're starting to come in. Our colleague Marielle is waiting to tee them up, and we haven't seen them. So, so Marielle, can we?
Thank you, Margaret. So one question that we're getting from our audience is there any recommendations you guys have for engaging those families that were so difficult to engage through via your virtual services in the last couple of weeks?
I'm sorry, could you repeat, Marielle?
Yes, of course. Are there any recommendations for engaging those family members that you were originally having difficulty connecting with via your virtual platforms?
I mean, I think for me, it's been more about consistency. There's only so much we can do. Like in an ordinary situation, we can do a home visit and we can pop up if we haven't heard from a family or a parent, right, in question. In this case, what we've done is reached out to other providers within the school building. And the beautiful thing is when you collaborate, as well as I think partnership does with other collaborators in the building, whether that's educators, administration, you can lean on them as well and say, I've been having trouble reaching Derek. Do you have a good AP so-and-so? Do you have a good relationship with Derek and his family? Can you reach out? And so I've also leaned on other support systems that I have to reach out to families. But I think it's consistency, like emails, calling, texting, all modalities.
Yeah, and I'll add to that too, utilizing who else knows the family. So in one school and I'm sure in many of our schools, one school I know a family in particular that has been very difficult to reach. And in our clinical case consultation, where we meet with the clinicians and we come together and have discussions on our cases and problem solve around different things, there's a particular family where they have several children in a particular school and none of them have been engaged. And so how have we been able to reach out to them? Well, we talked about ways of that child lives in a building where a lot of other kids live, a lot of other families live. So perhaps leaning on families who know that family, asking them, can you just knock on the door? Can you send out a text from, just to say, hey, we're thinking about you. We're concerned about you, sort of a thing. Hey, so-and-so is trying to reach you, that in that way. Additionally, so a lot of times, schools have really, I want to say schools often have paraprofessionals or teaching assistants who are very much connected to the families in the school. I know at one of the schools that I manage, almost all of the teaching assistants have been there for 10 to 20 years. That means they really know this community, and a lot of times their own children have gone to that same school. So now's the time to lean on some of them, utilize their connections with those families and with connections of that family too. Do whatever it is that you have to do so that we can make sure that they are okay. And if they need additional support, um, whether they're having health issues or any sort of issue, we can be present and we can at least let them know that we are here thinking about them and concerned about them.
And I just also want to throw in that we have, not only do we have partners in our schools who live in the communities we serve, but we have staff who do. And I can say with confidence that 2 of our family outreach coordinators are literally walking around their community, putting notes on the doors for families that they haven't been able to reach. We have had set a goal that any family that had not logged on within the first 2 weeks of remote learning, that we had to do whatever it took to ensure that that family was okay. And we literally have staff who volunteer to go out and slide notes under our families' doors.
Wow.
Thank you. The next question is, as we look ahead to returning to school in September, what steps can we take to support our educators and social workers to prepare them to support our students and families?
I'll jump in and answer that. I think, a lot of what we're talking about building capacity, and whether that's going to be face-to-face or virtually. And part of the work that we do all the time is professional. We have a whole professional development function where we're supporting our colleagues, our DOE colleagues specifically, and infusing social and emotional learning into our classrooms. How do we manage or support you in building capacities to respond to grief and loss when this shows up in an instruction that you're doing in September? How do we work with our principals and we have incredible relationships with our principals, to launch the year in doing trainings with staff to be able to execute this in the classroom, but more importantly, to go, one of our regular practices is that we do morning meetings and restorative circles in a lot of our classrooms in the morning. So how do we lead those to build capacity for teachers to be able to do that in an ongoing way, to do morning check-ins, to take the temperature of students, so that they are better prepared to meet that kids' needs that day, and how do we partner with them to do a lot of that work.
And I want to add to that, as I had mentioned before, really providing a platform that the staff feel supported, and making sure that they are also taking care of themselves, whether that's having an outlet where they can come together as a community of educators, and it could be one of our staff members leading a group, a support group, or just making sure that communication is happening in a meaningful way, and creating actual spaces that are ingrained in the school day or school week or school month, to make sure that adults have a space for themselves too. A lot of times we look at kids as needing to get themselves together or helping them get themselves together or whatever. However, as adults, we are the ones who provide the space for them, and we have to be able to be present emotionally and physically in a way that will be helpful to the children. And for that to happen, we have to make sure that the adults' needs are taken care of as well. So really becoming thought partners with the principals and administration in figuring out how to make that happen I think is one of the keys to making sure that we are supporting them coming into the new school year. And that could be, making sure that they have access to support over the summer, providing different options of what they can do, helping them to do a mindfulness activity on a regular basis, as well as providing that space, once again, as I said before, for the parents and families to come together to process this as well.
I do think a lot of the summer, as we're planning, is creating consistency for our kids and our families, but also for all the adults. And now that we can with confidence say, this is not a sprint, this is a marathon. And as you all have mentioned, the relationships we have with schools are going to be critical, because the truth is school has changed forever. The way we approach school, the way that we think about a school building, the way we think about school communities, it's changed forever. And I think that sort of teamwork and consistency all summer for each other, And I just also wanted to mention that I feel a real camaraderie with our peer organizations, and we're on a lot of task force and coalitions and working with, as Derek said, the Office of Community Schools. But the truth is, I don't think we've ever worked as well together thinking about these things, and really as a community of adults. We're going to need that consistency because everything has changed, and we're innovating or sort of, I think, fixing the plane as it's in the air. And I think that's going to be really important over the summer. I've noticed there are a bunch of questions about how people can help. And I think, my very quick answer, and then I'll let each of you answer, is that consistency that we can provide is what we base our program on all year long. So when kids are experiencing stress, and if there's no mitigating factor, if there's no buffer, if there's no feeling of safety and consistency, it becomes toxic, and it has severe mental health and physical health repercussions. Now that is all amplified, intensified, exacerbated. Every synonym is relevant. And I do think that consistency, that feeling of safety, that we all feel like the other shoe is going to drop, Derek, but how can we create that for kids? And I would say, from my point of view, and I'd ask you to comment as we wrap up, what are the biggest needs for kids and really for Partnership with Children over the next couple of months?
I can answer from my perspective. So again, we're looking to now have a 12-month program and not a 10-month program with our core services. But we don't have the capacity to do that. We don't have the human capacity to do that, and we're not resourced in a way to do that the way that needs to happen unnecessarily. And how do we buy books? This literacy curriculum that we talked about. That we are all trained in doing in partnership, but we need somebody to execute on it. We need to buy books to send to families. And from a child safety point of view, we are the eyes who are in these homes every day. So how are we supporting parents to inhibit potential abuse issues or substance abuse issues? Because I say that's one of the questions. But that, we all have individual capacity to be able to do all the things, the many things that need to be done. So like, how do we build our human capacity or to do this work?
Yeah, and I want to echo that as well. We'd love to do all the things. We'd love to have a clinician for the kids, a clinician for the family, the parents, a clinician for the school staff. But we just don't have that capacity. And of course that takes a lot of funding. But we would love to have those things. We would love to be able to provide additional professional development for the staff, to partner with additional organizations to offer, professional development and ways of.
I'm only smiling, Lola, because I feel like you're giving me a message too, and I totally appreciate it. So I'm taking notes.
To just offer more for people to grow professionally, to handle a lot of what the need is that might be outside of our scope, in addition to making sure that the families and the school staff have what they need too, and it takes a lot.
Yeah. And then I guess we're really coming up on the end, and I want to thank all three of you. Does anybody have anything that they want to add? I feel like there have been so many touching stories, and is there anything that's really touched you over the last several weeks that you want to share as we close out? And then I'll do one last thank you to everyone.
I think for me, I'm humbled at the experience. I think this is probably one of those rare moments. All of us clinically have had different experiences we can draw history from when we're about to engage with a clinical situation, right? Like, we've seen it in some capacity before, but I've never seen a pandemic. I've never seen a whole school shut down. I've never seen anything like this, a quarantine. And so I am very humbled by the experience, and I feel the same things that my students are feeling and the families are feeling. I'm scared just like they're scared. And so it's a beautiful but humbling experience, because I, for the first time, honestly don't know what the answers are, and we're learning together. There's this parallel process where I'm learning with my clients, my students, as we go through this together.
Derek, go
I
ahead.
kind of piggyback on that, it has been a privilege is really doesn't even cover it to watch our staff in this parallel process that Yvonne has talked about, where we have staff who are sick, we have staff who have lost multiple family members that are holding their own grief while holding our school community's grief by showing up every day for 10, 12 hours a day, or we don't have boundaries to our day anymore now that we're working from home, that they're holding all of that simultaneously while they have their own personal incredible loss and fear. We're all afraid, but our staff show up every day and hold that for our communities as well as themselves. So that literally blows my mind.
I think that goes, Lola, to your point that we really need to take care of ourselves and put your oxygen mask on first. So we're just at 4 o'clock, and I want to thank all three of you. I want to thank Lynthia, Latoya, and Marielle for putting this together. And I think we had well over 120 people join us today. That is so touching and humbling as well, and we'll do this again. Thank you to everyone who has helped us through this and who's supporting us, your offers for help. It's really been, true that this is not something any of us can do alone, and I feel, again, very, very privileged to be working with you, and I think we are on the front lines and will be for the foreseeable future. This is going to be a long tail. So thank you, and we will keep in touch.
Thank you.
Thank you. Bye.